Hi, this is Dee Dee. She has came in with a complaint of back pain, lower back pain, for the past 2 weeks. Right now, I will be doing a history of present illness, a past medical history, a family history, and a social history on her, just to get the basic interview process done. So, DV, you came in with a complaint of back pain. Can you tell me, with your back pain, was there any factors that make this pain worse?
Um, Probably lifting a lot, and if I sleep on it wrong.
Okay.
Yeah.
When you sleep on it wrong, is there a certain side that you sleep on, or is it just a
No, it's chronic. I've broken or I fractured my back before,
okay?
and did a lot of gymnastics um, and a lot of sports. So I'm assuming that's where it's from.
So just chronic stress you're thinking.
Yeah.
Okay. Anything that makes it better?
Um, Ibuprofen,
So medications
and I do a lot of sit-ups,
and a lot of
and that
stuff.
tends to help.
Okay. Okay.
And I
So
can't tell, but I do a lot of sit-ups.
strengthening those abdominal
I
muscles.
do, yeah.
Awesome. Okay. So can you tell me on a scale of 1 to 10, how bad does this pain rank on a? You said it was a chronic pain.
Mm-hmm.
On a normal day, how bad does this pain?
Well, like at night, it's about a 9.
Okay.
But during the day, probably about a 4 or 5.
Okay. Okay. And what kind of pain is it? Is it an achy pain, a sharp pain, a dull pain, a stabbing pain?
Probably an ache and a sharp.
An ache and a sharp pain. When do you notice the sharp pain happening? Is there certain things?
Probably when I stand up from a chair in
Okay.
a sitting position.
Okay. Um, so what region have you noticed it in? You said your lower
My hips.
your hips.
And my
Okay.
back.
Okay. Is it closer to the top of your butt, or is it higher up than that, or is
No,
it just
it's
right
probably
there?
the top of probably to the top of my rear end.
Okay. Do you notice it radiating anywhere else besides just your hips?
Yeah, when I go shopping and walk around a lot, my right leg goes numb.
Okay. Your right leg goes numb.
Uh-huh.
All right. So, any other symptoms with this? Any nausea, vomiting, anything like that?
No.
How severe is the pain? You said, it ranks out of 9 at night, and you're more like what did you say during
4
the
or
day?
5.
4 or 5 during the day. So you haven't noticed it get super severe where you think you need to go to the hospital or anything like that?
I'm a pain taker, so I couldn't tell you that.
So, okay. Okay, how many ibuprofen are you taking a day for it?
Oh, probably 6 a day.
Just the regular strength 200?
Yeah.
Okay. Okay. And have you noticed, when did you first start noticing this pain happening?
A couple of years ago.
And you said it's just been chronic since then?
Yeah.
Okay.
When I had my babies, I noticed it, but
Okay.
it became worse over the years. But the last couple of years,
Okay. And it is a constant pain, you said. It never kind of lets up.
not really. I mean, there's
Okay.
times that I don't notice it as much, but
Okay. So now that we've kind of understood what this pain is in relation to how you feel this pain, I'm just going to ask a couple of questions that'll go into your history. So we know you said that you had fractures to your back. You did a lot of sports. Any other past medical history at all? Anything for your head, ears, nose, throat, eyes?
not for me.
Okay.
No, not
How
really.
about chest and lungs? Okay. No problem with your heart, nothing like a murmur or.
I do have a murmur, but I don't have any problems.
But it's a benign murmur. You've had it checked
Mhm.
out. Okay. And then any problems as far as diabetes, high blood pressure,
No.
hyperlipidemia, any
No.
abnormal lab levels?
No.
Okay. No problems with your legs. No problems with your arms. No problems.
I have arthritis in my feet.
Arthritis in your feet.
I had
Okay.
surgery when I was young, and
Okay.
so
Has that?
that's normal.
Yeah. Yeah. Has but your feet aren't contributing to the back pain at all.
Oh, I don't know.
Okay.
It's possible. But,
Okay. So just the
and I'm
arthritis.
overweight. So,
Yeah. Well, it doesn't help any of us. Um, so, any other problems with your skeletal issues? Never been told that you have weak bones or that you need to take.
No, I have arthritis in my knees.
Knees as
I
well.
had
Okay.
torn a ligament before, so that's it.
Have you ever had a CT scan or anything,
MRIs.
an MRI on your back specifically?
Yeah.
And what were those? What did those
It
result in?
wasn't spinal stenosis. It's another name for it. It's where my bone has slipped like this.
Okay.
So,
Okay. And did they suggest at that time a treatment
a
for it?
physical therapist, but I started going to a trainer.
Okay. And how's that helped?
Yeah, I think so. So
Okay.
it feels stronger. So
Perfect. Perfect. Any family history that we should know about? High blood pressures,
Just cancer to
Cancer?
my mom's side. My dad had died of cancer, but they also were smokers. So.
Okay, so your dad's side has cancer, but they were smokers.
No, my mom's side.
Your mom's
my
side
mom, they had cancer, and no, not all of them were smokers.
What type of cancer did they have?
My grandmother had pancreas. My mom's twin sister had breast.
Okay.
And then my mom had lung cancer. They thought it was lung, breast. They weren't really sure where the primary source was. And then two of her other sisters died from cancer. I think they have a brain. I don't know.
Okay. Have you started screening processes for this yet?
Mammograms.
Okay. So you do the mammograms. Have you done a colonoscopy yet?
Yes.
Okay. Perfect. And those all came out clear?
Yeah. I have just maybe one or two polyps. I don't know if they're polyps, but spots, or whatever. And I got to come back in 3 years.
Okay. So you're on top of that.
On top of it.
Any other history? Hyperlipidemia, high blood pressures, lab levels, high lipids. Okay.
No.
As far as social history, do you drink?
Occasionally.
Okay. Occasionally, 1 glass a day, 2 glasses or more on the weekends.
Probably 4 glasses a week.
Okay. And then, do you smoke?
No.
Okay. Do you chew tobacco?
Nope.
Any illegal drugs?
I wish. No.
Okay. And now that we're kind of in here alone, I know the baby is here, but I'm not going to say anything. Any history of domestic abuse at all?
Well, I beat the shit out of my husband once.
No. All right. Well, okay. Any
I'm just
emotional abuse?
My children.
Okay. All the time. All the time.
No.
Okay. No history of any issues in the last year where you'd be afraid to go back to your home besides your children?
It's filthy right now.
Okay. All right.
But
we're okay there? Yeah. Okay. Any other social history we should know about? Any illegal drug usage? Anything like that?
I'm just kind of boring now.
Okay. How often do you exercise?
3 times a week. I do a strength training and then I walk.
Okay. How long do you walk?
About 40 minutes.
And for strength training, just typical weights and.
No.
Okay.
I'm telling you, sister. It's a pretty tough, rigorous workout.
Okay.
A lot of sit-ups, a lot of arm strengthening, a lot of back strengthening, a lot of we do all kinds of things in the class. So
okay.
It's a class.
As far as factors in your home that may be contributing to stress, can you just give me an idea of what may contribute to some stress?
All day, or
just a couple of things. A couple of the big factors.
Children.
The children, okay.
Better.
How old are your children?
I have adults, 4 adults, and then 3 young, still in high. Well, 2 in high school. 5 adults, I guess.
Okay. And you would say that that's probably the one.
That's probably my biggest stress factor. Yeah.
Okay. Is there anything else that I should know before we go on to the assessment portion? Okay, well, we're going to see you mainly for your back today, but we'll also do a head-to-toe assessment here in a little while.
Fabulous.
Thank you.
Mm-hmm.